So strep throat is a really common diagnosis in childhood. So it's mostly in ages 3 to teenage years. Those are really the most common. So school-age children are the most likely to be affected. It is possible to get strep throat under the age of 3, but it's usually in situations where the child is in a daycare setting or if there's a sibling in the home that has strep throat. Some of the symptoms that parents might notice would be obviously a sore throat. They can have swollen lymph nodes in their neck, which are your all up in here that show infection fighting cells. They get larger whenever your body's trying to fight off an infection. Kids can have fever. That's one of the biggest symptoms as well. They'll also present with a headache and a stomach ache, sometimes vomiting. Those are the main symptoms that we see with strep throat. Usually there's no cough or congestion to go along with it. However, in some of the smaller children, you may see a little bit of a rhinorrhea associated with the strep throat. So the way we test for it is a quick test here in our office. What we do is we have these little swabs that look like Q-tips, and we tickle the back of the throat. We get both tonsils and we get the way back of the throat. We run a quick little test on it. It takes about 5 minutes, and then pending the results of that test, we decide if we need to send a culture or not. So if our quick test is negative, we always send a culture, because sometimes our test isn't perfect and it doesn't pick up every single case of strep throat, but the culture will. So if our quick test is negative, the culture would grow, we would know that the child needed antibiotics. But if our quick test is positive, then they get antibiotics right off the bat. Penicillin is the drug of choice for strep. We usually use amoxicillin, which tastes better, and children tolerate it well. For kids who have penicillin allergy, there are other alternatives that we can use for that adequately cover strep. There's really no resistance of strep throat to penicillins. So, they haven't documented any cases of that. So. One of the biggest ways that children can reinfect themselves is with toothbrushes. So just like the disposable kind, I recommend parents, like whenever they figure out that the child has strep, that you change out the toothbrush about 5 days into the antibiotics, and then again at the end of your antibiotic course, because you don't want to be reinfecting yourself, and especially if your toothbrush is in the same cup, like as a sibling's, that sibling's at a higher risk of getting the strep. So I just change out the whole family's toothbrushes until we're strep free in the household.